Common causes of lower back, hip and leg pain. A number of specific conditions causing lower back, hip and leg pain may respond well when treated with therapeutic massage. Sciatica, piriformis syndrome, sacroiliac joint dysfunction, lumbar disc pathology, spondylolisthesis, neuromuscular pain, trochanteric bursitis, muscle strain and patellofemoral pain syndrome, and hamstring pulls. Spondylolisthesis, a forward or anterior displacement of a vertebra, knocking it out of line with the vertebrae directly above or beneath it, resulting in the spinal bone pinching the sciatic nerve. Sciatica, SI joint dysfunction, sacroiliac joint connects the spine to the pelvis, dysfunction or inflammation. Hip impingement occurs when the bones of the hip joint are abnormally shaped, leading to friction and pinching of the joint structures. Too much movement, hypermobility or instability. When the SI joint becomes unstable, the body signals pain in the lower back and or hip region and may radiate into groin area. Too little movement, hypomobility or fixation. When the SI joint becomes locked down, the lumbar spine loses range of motion. The pain commonly felt on one side of the low back or buttocks, and can radiate down the leg from dull numbness to a sharp shooting pain. When experiencing low back, buttock, hip, or leg pain, the underlying issue may be attributed to trigger points in the less well-known gluteus medius and minimus muscles, which could radiate from highly elevated and lateral muscle knots. The term sciatica commonly describes symptoms of pain in the hip and leg, often accompanied by tingling, numbness, or weakness. These symptoms typically originate in the lower back region, travel through the buttock, and follow the path of the large sciatic nerve that extends down the back of each leg. Here are some specific conditions that can cause the aforementioned pain. Herniated or bulging discs in the lumbar area can lead to compression of the nerve root as it exits the spine, or irritation of the sciatic nerve. Piriformis syndrome involves the tightening and spasming of the piriformis muscle deep within the buttocks. This muscle compression can irritate the nerve roots and cause hip pain. Nerve entrapment occurs when nerves become trapped between soft tissues. The sciatic nerve, passing beneath or through a tight piriformis muscle, experiences pressure that induces deep pain and numbness in the hip or extends down the leg to the foot. Lumbar spinal stenosis, when the bony cavity that holds the spinal cord begins to decay and narrow, which can put pressure on the nerves and cause pain in the lower back, hip, and leg. It is often associated with aging and degenerative changes in the spine. Lumbar strain or overuse, excessive physical activity, improper form during exercise, lifting heavy objects, poor posture or sudden movements can strain the muscles or ligaments around the hip, resulting in pain. Bursitis. Bursae are small, fluid-filled sacs that cushion the bones, tendons, and muscles near the joints. Hip tendinitis. Tendinitis is the inflammation of tendons, which are thick cords that attach muscles to bones. Inflammation of the bursae and tendons in the hip can cause pain and discomfort. Osteoarthritis. Degenerative changes the cartilage in the hip joint or the lower back wears down and lead to arthritis, causing pain, stiffness, and reduced range of motion and radiating down the leg. Hip labral tear. The labrum is a ring of cartilage that lines the socket of the hip joint. A tear in the hip labrum can cause hip pain, especially during certain movements. Osteoporosis can lead to vertebral fractures or collapse. Hip fractures. In older adults, hip pain may be due to a fracture resulting from a fall or injury. Muscle imbalances or weakness in the lower back, hips, or legs can lead to pain and discomfort. Thanks for watching and welcome.